You're watching Good Business San Diego, sponsored by KUSI Asset Management. Welcome back. We thank you for watching today. St. Paul's Senior Services has a long history of helping people to find appropriate housing solutions to accommodate their lifestyles and their needs. McHale is the CEO of St. Paul's Senior Services, and he is here today to talk about how the assistance that they're able to provide for seniors is helping as they face difficult decisions about affordable housing and health care both. And so many people are affected. Mike, thanks for coming in to talk about this today. Really important that we do. First of all, if you just give us a little perspective on St. Paul's, the background, the history.
Sure. Roy, thank you. It's a pleasure to be here with you today. St. Paul's has been serving our community since 1960. We started as a senior housing provider and offer a continuum of housing options in terms of independent living, assisted living, memory care, skilled nursing. We're also a health plan for older adults in San Diego through our program of all-inclusive care for the elderly, also known as PACE. So between our two programs, between our housing program and our PACE program, we serve about 1,800 of our residents a day.
1,800 a day.
Yes.
That's huge. And of course, as the population ages, that number is going to increase, as we were just talking about a minute ago. So many people living longer lives and in need of care. How are we going to keep up with the demand?
Well, you know, that's a great question, and it's a complex question.
Yes.
And I don't mean to be the bearer of bad news, but if you wouldn't mind sharing, if I could share a few statistics with you. You know, as we look at the baby boom population that's now kind of the tail end moving through, seniors are going to make up 30% of our total population in the 2030s. And for the first time in the history of our country, we'll actually have more seniors than we do have of people under the age of 18. That's our future tax base. And it's going to have fiscal and policy implications both nationally and here in the state. You know, in San Diego County, by 2030, over 1 million of us will be over the age of 65.
That's amazing.
What we do know is that 80% of our seniors will live with at least one, if not more, chronic conditions. And it's in these chronic conditions that we're able to live longer because we can better manage them. But it has a fiscal implication to the individuals and their families because as we live longer with disease, we have more cost associated with healthcare and related costs of living with those diseases. And so part of the challenge as we move through this baby boom population is that many of our seniors will be living on fixed incomes. And it's estimated that 30% of them will be at risk for outliving their resources. And so we at St. Paul's know we have to do something about that. We have to figure out ways to be proactive and begin to prepare now for this population that's moving through. And so we're looking at designing and building more affordable housing for our seniors and more affordable healthcare options for our seniors because those are the two biggest expenses that they're going to experience as they age.
And again, you may be looking at somebody that's living to the age of 100, but in need of healthcare services at 70. 30 years being that window. It's really daunting to think about that. There's also the really sad reality that some of these people, because of the economics of it, may fall into homelessness. So how's that being addressed?
You know, we're waiting for the point in time count to come out. It just happened at the end of January, but our most recent data is showing that 29% of the region's unhoused are over the age of 55, and 46% of these are brand new homeless folks. So we think we're seeing the tip of the iceberg as it relates to homeless for seniors.
Mike, we've got about a minute here, but let's talk about the PACE program, as you mentioned. It's helping seniors with chronic illness. How does somebody apply who qualifies for that? Yeah,
PACE is an age and income restricted program. So you have to be 55 years or older to be eligible for the program, and you have to be able to receive Medicare and or Medi-Cal and need assistance with 2 activities of daily living, living safely in the community.
So if somebody's looking for help with all of these services, they just contact you through the website or a phone call and schedule a consultation to see what they need?
Absolutely.
Okay, great. Thanks so much for coming in. Really appreciate it. Come back again. We'll talk more, okay?
Thank you.
Thanks, Mike. Appreciate it. You can find out more information at stpaulseniors.org, stpaulseniors.org. And that will do it for Good Business San Diego today. Content segments during the show were paid for by GradMap, by College Planning Source, the San Diego Seals, and also by Epic Discounts. If you'd like your business to be featured on the show, just email us at mygoodbusinesssd@kusi.com. We'll get back to you. Thanks very much for watching today. Have a good day.